last presenter for the day, we have Mayo Capicol, Director of Digital Services, and Tim Dawson, Director of IT Solutions, Fraser Health. Mayo is a seasoned information technology professional with a diverse skill set spanning business systems analysis, project management, strategic planning, process improvement, personal development, and technical IT expertise. Mayo has over 6 years of senior leadership experience at Fraser Health Authority, concentrating on strategic initiatives with the digital health corporate and facilities support services portfolios. Tim has extensive experience in leading facilities management and support services at the design, operations, and innovation level. With a focus on integrating systems and enhancing patient flow, Tim has consistently driven improvements in service delivery and operational efficiency. Together, they will share Fraser Health's roadmap to optimizing integrations using Connexall. Lots of love. We're going to welcome you to the stage.
Okay, thank you. Good afternoon. Thank you, Jane, for the introductions. It's a pleasure to be here. It's my third Connexall conference and first time presenting. I'm very excited to be in the position to give back. I learned a lot from these conferences, and while being nervous, I'm very excited as well to share exciting work that we're embarking upon with Connexall. So this is me, and my colleague with me today is Tim Dawson.
Tim Dawson.
Okay, so a little bit about Fraser Health for those that are not familiar with our health organization. So we're coming from British Columbia, Canada. Fraser Health was created as a merger of 3 health regions in early 2000s. And currently, we're serving one of the most diverse and fastest growing populations in British Columbia. We are the largest of 7 health authorities. And some of the stats, so we are 46,000 employees strong with about 5,000 contracted employees, including physicians. Our annual operating budget is about $5.5 billion, and we're a publicly funded health authority. We are operating 12 acute care hospitals, geographically about 150 miles east to west, and we're running about 6,000 publicly funded beds. We also are operating about 80 long-term care facilities. Most recently, we introduced 11 urgent primary care centers, and we have a number of community sites. So what we do and what we're going to share today is strongly embedded in our vision, really to be national leaders in driving digitally transforming healthcare and to strive to better health and being best in healthcare. So our partnership, and it truly is partnership, with Connexall started back in 2008, so more than 15 years ago. And our first implementation was not clinically focused. So actually our first use case was in support of our facilities maintenance operations. And it was in our largest and oldest site, Royal Columbian Hospital, so where we integrated Connexall first to monitor 2 different nurse call systems and respond to hardware failures and similar notifications. So it was a local install running on a computer on the desk, very typical for that period, but we still stumble upon those solutions, believe it or not, today. So, and Tim and I are committed to change that. So in 2010 and over a period of 2 years, it was our largest project with Connexall when we centralized our switchboard. So following the merger of 3 health regions, we centralized 12 separate call hubs into one contact center with 2 geo-redundant locations. It was the first time that we introduced framework of quiet hospital, so reducing all overhead paging to code communication only, and we needed a platform capable of supporting our centralized communication, and Connexall met all the requirements. It provided scalable virtual architecture. We moved on to the server environment, provided the required uptime and failover ability, and it was able to integrate all our different nurse call systems. At the time we had 4. 3 different fire manufacturers, about 5 systems at a time, legacy blood bank, medical gas, vacuum suction rooms, and it was able to display auxiliary information in standard format and differentiate between the 2 call centers. Since then, we continued expanding our platform, and primarily through capital redevelopment projects. We introduced new nurse call systems, new downstream systems. So Vocera was introduced in 2012. Some limited workflows for environmental services support through nurse call. And also most recently, as part of our Abbotsford Regional Hospital repatriation project, we integrated a direct system for security alerts, and we also automated code paging. This year, we focused on modernizing our foundation. So we moved our system to our new data center for scalability. We upgraded servers. We also moved to a Connexall web platform, introduced the remote management client. We're just in the final stages of preparing WorldConnex for rollout. And we also introduced integrations with Active Directory and Meditech Expense and Client Server, which is our EMR platform. And this is all to prepare us for what we're here to talk about, for our Connexall Collaboration and Integration Hub, and something we'll talk more about today. But before we do that, Tim will talk about current state Connexall just a little bit more.
Yeah, so current state, no small feat. We do about 1,800 alerts through 16 facilities, 7,000 devices, 46 SIC inputs, 3 SIP inputs. Most recently, we integrated 1,500 beds for Vocera rollout with Royal Columbia Hospital. And you can see, that workflow all the way down to that pager level and overhead paging level.
So despite merging into a single health authority many years ago, many of our systems still remain disconnected. And so many of our solutions as well are introduced at a site-based level without going through a proper solution design, proper assessment, and with minimal integrations and interoperability. So this is creating all sorts of kinds of pressures and risks to our organization. And so this is our plan to change that. So the lack of integrations, introducing different kinds of costs, not just financial. So this impacts patient care and outcomes. It impacts our staff satisfaction and ability to perform and experience. Cybersecurity and privacy risks are exponentially growing, and all the manual integrations are putting a lot of pressure on our technical support teams to be able to keep up, and not to mention the risks of manual data entry and errors that it's prone to. Data isolation really hinders our ability to innovate at scale. So we've been working on many AI solutions, and we have some great innovations coming, but it's very difficult to move past the proof of concept phase because of this current situation. So what's our plan? So we need a better connected healthcare system, and so we believe that Connexall's interoperability platform and our collaboration hub paradigm can help us empower the organization to move forward towards a better connected healthcare environment, and to help reduce these data and workflow silos. Having better connected systems, integrated systems, and standard solutions will help us better inform our major investments and ensure that those investments are aligned with our digital health strategy and supporting enterprise at large, not just focused on a single site. And Tim will talk more about the benefits of our integrated collaboration hub.
Exactly that. You were talking about data-driven decision-making, and it really comes down to a lot of factors. And some benefits to the hub, the accelerated innovation capacity to be able to actually put these things in a hub and work with them without creating risks related to interrupting clinical workflows. Like we can put this in, we can work with our staff, we can bring them into the hub, we can show them how it works. We're always working with Connexall, always working with Connexall. They are tired of me. I love them all of you. I'm always working with these guys, working on innovation, working on how do we make this cost effective. We're a publicly funded organization. Every cent counts. We're not throwing money at things. One thing I noticed in discussion with a lot of you folks is that we're different in that we're trying to go get money for this. You've already got the money. You need to work on how do you realize that investment? How do you capitalize on that spend? And we're doing that work to be able to get that funding to be able to go to implementation. So you can see there's a lot of things that really fold into this, right? It's about operational efficiency, ensuring that what we're doing is better. We're not here to just replace systems. We're here to look at how do we improve them. I'll be perfectly honest, I'm not the tech guy. I have 10 tech people under me. I'm the one who signs the POs. Every time those POs come over my desk, my question to my staff is this doing what we're paying for these people to have it do? And oftentimes the question is, not really. So why are we spending this money? Let's put it in the hub. Let's make it work collectively. Let's make those data-driven decisions, and then we move forward. So yeah, about that, I just went through it, but realizing ROI. So since arriving here, a common conversation piece is just that, right? Realizing the value of your investment. For many, Connexall has been purchased for specific purposes. I talk to you guys, I use it for, patient monitoring. I use it for nurse call. Realizing the value of the enterprise solution is just, I think, it's just so vital. A major motivator for us to get to the collaboration hub was literally that. We just need to show the organization the value of what Connexall can do and how we can take all those different streams and put them into one and drive that data to making proper decisions.
So moving forward, I'll share just a piece of our near-term digital health strategy. And so we're currently in our first horizon, and so we're working on digitizing our current environment. So modernizing our Connexall platform was aligned with this strategy. And so next year we will be moving to our Horizon 2, which really focuses on integrating digital capabilities across the enterprise and looking how we can leverage AI and automation to drive our organization forward. And looking to 2027 and beyond, we really want to build on technology and culture to drive further, and accelerate digital adoption, across all our sites, acute and also, across long-term care and other sites. And so our Connexall roadmap that we will present to you today is well grounded in these principles and is aligned with this strategy. And I have to share a few key initiatives which are actually creating the foundation and are key enablers for the work that we're starting with Connexall. So we have about 6.5 billion committed to our capital investment, large capital investments. So we have 3 redevelopment projects underway. We have a new build that's coming in 2030. It's our new Surrey Hospital. It's supposed to be the most advanced digital hospital in British Columbia for sure. And Connexall is certainly one of the proponents, and we're actually in early discussions with our solution architects to start building and using our innovation and collaboration hub to understand how Connexall can help us drive the unified communication strategy and interoperability in this new state-of-the-art facility. We have major transformation programs underway, so we're moving from client-server to expense right now, so we're about 30%, 40% done. We also are modernizing our employee experience across the board, and these initiatives are very important because they are actually shifting culture to digital and are creating digital literacy across the organization that will be critical to adopting new solutions and mobile platform and having devices and processes in place already that we can capitalize on and actually will drive our roadmap forward. And it's very exciting that, seeing on the roadmap today that Connexall is planning to expand solutions related to smart hospitals and actually focus on areas other than clinical, because that's one of the areas that's extremely important to us. So we have our integrated facility systems. We're looking into converged networks right now, so we're looking how we can create better connected environment there as well. And our commitment to digital is best represented in our digital twin and digital front door initiatives that are currently underway. Okay, so now exciting stuff.
Yeah, this is the exciting part. Getting back to, my discussion about making that connected hospital. And it's been a challenge, getting everything to where it needed to be, getting buy-in, we went through a major data center upgrade where we went to a managed service solution. So we went from having a very well-known and expected solution over to us really driving some need for looking at things like, how do the VPNs work, how do the firewalls work, everything like that. It's been a labor of love, and we wouldn't be here without those staff back in Ontario. Just absolutely couldn't be happier. But so where we are right now, we've got the hub. It's there. Getting back to the finance part, we don't get significant amount of money for R&D. So what we looked at was how do we better utilize our funding? And job one was looking at some of our big expenditures, and one of them was our EVS services, so our housekeeping services and patient tracking services. So we said, okay. I was here last year. I got a look at their EVS solution. I said, this looks great. This looks like something that we can utilize. And to be honest, I've only been working with Connexall for a couple of years now. So I wasn't fully aware of that massive enterprise capacity that they had. And I said, wait a minute. You mean I can have this and all this, and I can do that for less than I'm paying for housekeeping? And I was just blown away. And from there, it was just me bothering him constantly. He's trying to enjoy time with his family, and I'm just there bugging him. We're on to WorldConnex. We've had our trials and tribulations there. We're going to get into the transport tracking, which is our patient or our portering system. So that's really exciting. Clinical communication dashboard is all those whiteboards you're seeing back there. That's kind of something that we're looking at integrating. We've already done the integration of Meditech in a test environment, so we'll be rolling that out right away here. Pager replacement, I'm going to be picking brains. I absolutely love these things because I come here. I'm talking about a massive roadmap, and I get to see people who did this. And it's just inspiring for me, so I'm super pleased to see it. Again, Eureka. This is what we all worked for. It took so many people to get us here. This is mine. And honestly, going back to opening a new hospital, like people are, I'm kind of a weirdo. I kind of want like a new hospital smell air freshener. I love new hospitals. I built them forever. This is my new hospital in my new position. This is it for me. I'm just so pleased. So here we are. We've built out. You've seen this. It's not anything different. But so what are the drivers and benefits? We have an opportunity to replace out-of-the-box solutions. We've already talked. Everybody's talking about those out-of-the-box solutions. It's a partial. It's what works okay for us, but it's easy because we just take it, we put it in there, and away we go. And then we hear the complaints for 3 months, and then they either get used to them or they just stop using it. Holistic patient flow, from housekeeping all the way to transport tracking to patient tracking. The combination of this data enables the hospital to better understand the demands on their resources based on multiple sources of data. And not only is it real-time decision-making, the data will support critical business decisions. Supply tracking and replenishment is a big one. Oftentimes they're just getting all that data together and making those decisions is just challenging, and it can cause backlogs. I'm also fairly involved in the hospital replenishment, so having that capacity all the way to that end is just a huge benefit. So here we are. Again, this is just exciting for me. I'm going to be deploying this out at one of our small hospitals. I guess to talk about scope of hospitals, we have one hospital that has 12 beds, but it's also 150 miles away. So, it's a perfect opportunity for us to show the organization how we can scale. This will be, you see FC, that's Fraser Canyon, that's my hospital. You've seen all this too, but this is ours. We built it. I just couldn't be happier. You've seen this too, active alarms. This will, the first one of these to go out is just going to be incredible for me. I just can't wait. Active alerts, we've seen those. This is me. This is me. That's my name. I'm not going to be the first one putting it out, but I'm just pumped. It's hilarious, I don't know. So, we want to demonstrate that Connexall EVS can not only perform as well as our existing solution, but it can do better. It can address pain points. That out-of-the-box solution, it did the trick. We were also in a really transitional stage because we were repatriating. A lot of our services went out. We were bringing them in-house. We didn't have robust requirements because we were dealing with organizations that were outside of our organization. So the decision-making was really based on very minimal criteria. So we built our own success criteria. We went out to those users. We listened to them. We built that success criteria. We did full current state assessments. We went to Connexall and we said, listen, we're going to get the organization behind us. You got to be on our side with this. And, to their credit, they've never faltered. There's our dashboard, communication dashboard. I didn't put the right one on because the cool part is what we're working on too is RTLS-based location data that will be in this whiteboard. So as people transition from room to room, we're going to see them on this whiteboard. Super exciting. And the other thing about this is that this was an idea based on a redevelopment project that went and bought 50 monitors and they didn't know what they were going to do with them. They just had spots on walls for them. So they came to me and they said, what can we do? And I said, well, let me go talk to Connexall. And Connexall said, we can do whatever you want. And I said, okay, well, let's talk to the people. We had somebody on the job. They came with robust requirements. This came out, I think, probably within a week. And then they refined it and they refined it. 6 weeks later, I've got major decision makers who want Connexall. They want it there. They're pushing briefing notes to get this in their design. Okay, where are we? Okay. This kind of speaks for itself, the type of data, and really, it's out there. Their data's here. I'll give you an example. I showed up here on Friday, jet-lagged. I gave myself about 3 hours of sleep. I got into a discussion with Tim Chan and Jason. And I said, listen, I've got a use case. And they said, okay, well, tell us about it. So I told them about it, and they said, oh, that's interesting. And then about 18 hours later, I get a message, and they say, do you want to come see it? Are you kidding me? I saw it. It's there. Unreal. I ask for quotes from people, and it takes 5 weeks and 5 emails to get a quote. I got a solution in 18 hours. So then further on, building on that success, that's just the beginning of it. This enterprise solution is just, it's just going to give and give. We were just talking about that, right? The building the communication tools for facilities, thresholding, emergency response, you name it. This one's close to my heart because I'm an AV guy at heart. So, we're talking about an automated acknowledgement-based code system that eliminates the workflow that requires a switchboard. When somebody hits a code blue, we're looking at an acknowledgement coming back and a code blue going text to voice over a QSC system, maybe 30 seconds as opposed to 3 minutes. The patient monitoring pilot, you guys have all done that. I'll be picking brains. I always ask Frank, give me a name, I need this. So we're coming at you because you're doing it. I've already made a great friend here. He's my guy. I'm going to be bugging him a whole bunch. We got to work out the time zone difference, though. So then RTLS expanding to patient flow. One thing about our existing patient flow is that it doesn't actually work with the other applications that are attached to it. There's no cohesiveness. So I'm paying for 3 different systems, and they all have the same name, by the way. And none of them actually talk to each other. I'm going to get that working. It's literally bang, bang, bang. Fall prevention, my man Carl. He's in my dreams. I love the guy. I've never met a guy more dedicated to a cause. I mean that. And then integrated protective services. We're looking at another repatriation event where we're going to be pulling all security services out from multiple external sources and putting them in one place. And these guys are going to join us on that journey. I got Frank on call. Get that sleep, buddy. It's coming your way. So then long term, infusion pumps, they're outside. They're really important people, that's clinical stuff. I've got a whole clinical team on top of that and endless clinical support here. Bed location, my Humano guys, I told them I'm going to mention them. One thing I found joining the other side, I was facilities. I was the guy who put hospitals up and then I walked away. Joining this team, what I realized is how willing large companies are to get great ideas and then to charge you a whole bunch of money for them. And they come to you and they sell it to your clinical staff. They say, it can do this, this, and this. And the clinical staff says, we want it. And then they come to us and we say, we don't have budget for that. So we've got these beds that cost a fortune and we've got no solutions because we don't have money to run them. So what I want to see is I want to turn that around using Connexall. I want Connexall driving these people to improve patient health, to make wellness matter. Bed management, along that, this all ties into bed management, including perioperative workflow, right? Those patient tracking solutions going from various surgical departments throughout the facilities. And then finally, Jarwan, my guy, I sung this guy's praises right out of the gates when I met him. I've never met, this guy knows his stuff. And honestly, everyone who sat in his demos, it was just nothing but praise. They said, I want that solution, 100%. That guy knows his stuff. And then on to you.
Yeah, thank you. So we have ambitious plans, and how are we going to get there, right? So we need to shift the paradigm, right? So we need to leverage our collaboration and integration hub to really shift the view of Connexall and move from that centralized switchboard to connected healthcare environment. And we know that Connexall has a strong interoperability capabilities, and it's been our incumbent vendor for over 15 years. So we know that it's stable, reliable platform. It's been our partner, and it's known vendor. But the problem is that the perception of Connexall organizationally is that this is our code communication middleware, right? So and we need to shift that view and show really what the possibilities are. So the key is really collaboration, and not just internal collaboration. It's working with our clinical business teams, with Connexall, but also other vendors that we will be integrating with. And what Dr. Lambert said yesterday really resonated with me. It's it starts with the business problem and opportunity, right? And technology is enabler, but not the driver. So we need to make sure that we have user-centered design as at the center of the work we do. That we build those compliance requirements, regulations, workflow requirements into the solution, and we go through iterative process to design solutions that really work, that will ensure adoption and scalability. And on the financial side, obviously that's always a concern. So our business case strategy is really to go through that phased approach and focus on moving to enterprise Connexall platform, scaling and enabling capabilities as we move along and as we're realizing benefits from the early implementations to create sustainable funding model to get us through what we shared today, what really our end goal is to have a truly integrated and connected environment, and to ensure that investments we're making into our capital and investments opportunities that we have are supporting our entire enterprise, that are not just focused on single site and single solution. So that would be all. Surprised that we went through as quick, but happy
really
to
fast
answer any questions if you have. Thank you.
Still on? Can you hear me? Yeah? Okay.
Hi, I have a quick question for you. Your roadmap over here, your roadmap is fantastic. Who participated in coming up with that roadmap?
So yeah, we've definitely engaged a lot of different groups in the organization, and I'll be perfectly honest, they asked me to build a roadmap here. The reality is that roadmap changes from week to week. It's, we get people coming and they say, hey, we're hearing about this. And the important thing is they got funding. If you've got funding, you just move to the front of the line. You're our new best friend. So, it's always going to change, right? But ultimately, we have this goal. We want to get there. And you have to set these goals. Otherwise, you stagnate, right? We've had this solution for 16 years. We're pushing it. This is where we want to be. We're gonna move it along. operationally and strategically at the organization level, we need these plans. The one thing that I think really lacks across a lot of organizations is that strategic planning, that, looking at the future. Everything's, what do we need right now to get by?
Other questions?
Hi, it's David Shiver from Stanford Healthcare. One of your points there in the roadmap was about Meditech integration, and we heard today that it's limited, and just wanted you to expand on what that entailed.
Okay, do you want to start it?
Yeah, I mean, we can talk about, those limitations. I think somebody already mentioned it, right? Was, the limitation on the ability to give out or to have certain assignments, right? The ability to put information back in the system. One of the complaints we have about a lot of our patient flow solutions is that it's not being reflected at the EMR level. So what's happening is they're moving these people along in, let's just say the initials could be TT. We're moving along in TT, and they're having to go into Meditech and make those adjustments as well, right along, right? So the double work is causing issues. Just not getting great value out of those systems plugging back into Meditech. So, we need to affect change by implementing solutions that really complement the Meditech system as opposed to, exposing its weaknesses.
Yeah, and we're just in the middle of transition to Meditech Expand, so a lot of our clinical workflows are just being built. So it's really understanding where the clinical is going, and staff assignments is something that we're not doing right now. So it's going to be a cultural shift as well. So it's not something that we can drive with our Connexall roadmap. So we will kind of be looking towards our clinical to align with them and kind of map out what does that look like in terms of the opportunities that we have within our Connexall integration platform.
Yeah, and other examples, isolation data. A lot of our, one of our major customers that we liaise with is the housekeeping team, and that isolation data is just extremely valuable to them, right? You look at things like tuberculosis exposure, things along those lines. Like, this information needs to make it to that application in order for safety's sake, and we're having issues addressing that. So it's growing pains. We're in everything's moving at once.
So I'm going to ask on behalf of my friends in sales. I couldn't help but notice you singing a lot of praises, and thank you for that. By the way, Mike, and I'm legal. How could we, Connexall, do better in sharing that message at higher levels within hospital systems? We have a lot of folks who are empowered, enabled, and believers in Connexall, kind of in the middle tier, but we seem to be enabling those folks, but we also don't do enough to pass the message up the chain. Do you have any suggestions for us in that regard?
Probably more trips to Boca Raton.
Oh, okay, got it.
But in all seriousness, I think it's about getting the people who are administering this day-to-day to believe in it. And, the organization, it'll be organic from there.
And for me personally, I think, going first time to Nashville and attending one of these conferences and seeing the possibilities and learning more about system. I supported system for 4 years before going to the conference, and I didn't know like 1/3 of, what Connexall can do. So this collaboration and innovation hub is really to explore these possibilities, to showcase, right? So it's one thing to talk about, the other thing is to be part of the development and to see firsthand that, this is what we can do, and this is, like we're building this together. At the C level, we're very excited to see, what's going to come from, your newly formed panel, and, we're certainly, we're looking forward to, engaging our executives as well and getting them more excited about the opportunities that lay ahead.
This isn't a question for you guys. It's just I want to expand on this so the rest of his bosses can hear. I think one of the best things you guys can do is make your new features and stuff like that as easy as possible to implement for existing customers, so that the upper management people at all of our healthcare systems, when they start walking around and seeing things, go, oh, what's that from? I haven't seen that before. That's one of the best ways to do it, and I'm going to harp on it again. Make it easy for folks to be able to make updates and to like things like call points, nodes, et cetera, stuff like that for those features. That's my 2 cents. I'm off
You
my
make a great
soapbox.
point there. That's an excellent point. I think, I'm really excited about the prospect of the WorldConnex mobile too. The capacity to look at like a catalog structure, so that when when we have these use cases, we can actually, I don't want to liken it to Cisco, but Cisco does have, that, what do they call it, the fire hose. Like to have the capacity to look at, what other groups have done. The feedback I get from major redevelopment is that they Google Connexall and they get a one-pager. They're not getting, robust data. And they want to know where to go. They know that it's me because I bug them every day. But, maybe not everyone else has that cheerleader. So, having a little more exposure to understand where, your roadmaps. I understand from, you have to keep your things close to your heart or close to your chest. But, that is the feedback I do get, is that the one-pagers really don't encourage them or inspire them to look further.
And just to build off what you were saying, Mike, or asking, and you, not only does it need to be easy, but leverage your new BI capabilities to create dashboards that put those numbers right in front of your C-suite executives, because they live and die on graphs. They don't want the detail. They don't want to see the lists. They want to see the dots going up.
Yep, you're exactly right.
Thank you for the honest feedback.
Ralph Hullett with Community Health Network out of Indianapolis. On your roadmap, you mentioned real-time patient location management with RTLS. What strategies are you looking at or deploying in that direction?
Yeah, I mean, that's ultimately, organizationally, we've settled on a very expensive RTLS solution. So what we're looking at is, that value proposition, and what I'm hoping is by the time we actually make it there in that part of the roadmap, that the solutions have both improved and become less costly, right? Because ultimately, our decision making is based on what it's going to cost us to implement, right? So, I'm pushing creative solutions using existing infrastructure that doesn't, put us at a massive deficit, or create that negative connotation for that service, because what you're providing them is expensive and it doesn't meet the need. So, I mean, I guess it's in what is it, in construction? I don't know.
Yeah, and I think also scalability is very important for us, because we have, our 4 primary tertiary sites that get all the funding and attention, and, we're not able to scale to our community hospitals, and so we have discrepancy in the care quality and the expectations, right? So we need to, drive solutions that are scalable across the enterprise and, leverage those big investments to actually be able to, deploy to our, 150-bed community hospital, the same kind of, level of care.
Yeah.
Thank you.
All right, seems like no more questions. Well, thank you very much. It was really a pleasure to present today. Thank you.